Greetings, Patriots. Welcome back to the Albert Plan YouTube channel. I'm Dan Albert, and I want to discuss with you today my thoughts on the confirmation process today, October 12th, 2020, in the Judiciary Committee, the Senate Judiciary Committee hearing regarding the confirmation of Amy Coney Barrett as a justice on the Supreme Court. Democrats have taken a strategy that was laid out today very obviously that they're trying to make this confirmation process all about the Affordable Care Act and basically health security, health care, health insurance coverage, all those things related to the Affordable Care Act. And they put forth pictures of some beautiful Americans that they're asserting were able to get medical coverage because of the Affordable Care Act, Obamacare. They're trying to paint the picture that Judge Amy Coney Barrett is going to vote or I guess you can say that justices do vote in terms of deciding a case, that she would decide in favor of the government and against the Affordable Care Act. And the reality is that the test before the court would be about the law. And it's pointed out brilliantly by some of the Republicans on the Judiciary Committee that the case going before the Supreme Court isn't the final answer. If it was decided against, if let's say Obamacare was ruled unconstitutional, which it should be, and I'm not going to make this video about why that's the case, but if they do decide it's unconstitutional, it could be because the wrong actor was engaged in the process. The issue was handled the wrong way. The legislators can go back to the drawing board and recraft legislation to get the job done if they choose to do so. And then it would be, whatever they come up with would be run through the constitutional test to see if it's constitutional or not. So, in their tirade about how this is a sham process, an illegitimate confirmation process, unprecedented in Senate history, which is all bogus, they fail to mention that Obamacare itself was enacted because they took a bill, stripped it, and amended the bill and put in 2,500 pages or so of Obamacare into a bill that had already gone through a process that only required, it was a bit of legislative chicanery that took place when they did that. They also had Louisiana Purchase and the Cornhusker kickback to get a couple of senators to come on board with the legislation so that they could actually bring it to a vote on the Senate floor, the filibuster. So they passed Obamacare without a single Republican vote. And Obamacare is a job killer, and it's just a stepping stone to take our country to a single-payer healthcare system. That's what they want. That's what the left wants. That's what Democrats want. Anything that grows government, they're in favor of. And they're into accruing power and more power to fewer people. And they're very destructive in their methods to that, and that result would be very destructive for our country. So you have that back in the background that what's really going on is they're pushing for single-payer system, Medicare for all. That is the natural progression that we'll see if Obamacare stands. That's where we're heading. And so, we don't accomplish much top-down. Liberty is decentralized and distributed. Education should be decentralized and distributed. Healthcare should be decentralized and distributed. And in my book, The Albert Plan to Save America, I have a chapter on free market healthcare. And what does free market healthcare look like? It doesn't look like what Democrats propose. In fact, they're trying to destroy any chance we have of having free market healthcare. Back in around 1960, healthcare costs were about 5% of GDP. And today it's pushing 20%. And with Democrat control over the process and pushing toward a single payer system, we will have worse care for higher costs. That's what we get. Free market would bring better care at lower cost. So why are we at 20% of GDP? When you look around and you see all that's produced in goods and services in this country, 20% for healthcare is ridiculous. That's just, it's because of market distortions. Why have markets been distorted so much? Because government's been tinkering in the whole process the whole time, and they've shut out free market forces from driving healthcare costs down. They're moving us to a single payer system at great speed, and by opening up the free market to let the free market establish prices and reward winners and losers instead of the government trying to do that, then we would see healthcare costs go down. You see that with anything that is elective eye surgery. LASIK 20 years ago was $3,000 per eye, and now you see advertisements for $250 or $300 per eye for LASIK surgery. Elective surgeries go down in cost. You see a lot of price discrimination going on within the marketplace, the so-called marketplace, in today's healthcare environment. Big pharma and big medicine are growing out of control. And if you follow the money, you'll probably see that they've got most politicians in their pockets, even Republicans, free market, supposedly free market capitalists are sort of on the take. They've taken donations from big pharma and big medicine, and so we have a problem with what do we do about this? Well, like most of the solutions I propose in my plan, the solutions are simple, but they're not easy. So the problem that we have in the healthcare market today, and Democrats try to equate health insurance with health care. Those are not equivalent. Health insurance does not equal health care. So they make it seem like people that don't have health insurance just don't have health care, and that's not true. So when they rattle off their numbers of 23 million people might be without health care and that kind of thing, or health insurance, they're trying to scare people with the tactics that they're using. But in reality, the problem was created and is sustained by the existence of a third-party payer system. We have third-party payers paying the bills instead of patients. Democrats want to take us to a single-payer system. The government pays for all bills, socialized medicine. That's where they want to take us. And they will get us there if we let them take us down that road. But I advocate for a single-payer system where the patient is the single payer in every healthcare transaction. And if we eliminate third-party payers, patients would be looking into the cost of healthcare. And there are a lot of free market mechanisms in place that are already functioning fairly successfully, even in the high-cost environment that we're in. There are healthcare sharing ministries that exist that share medical costs. There's crowdfunding that could happen. If you eliminate the third-party payer, who are the third-party payers? Right now you have health insurance companies are third-party payers, and you have government. So because you have government paying healthcare costs and insurance companies, and the way that legislation works, it mandates escalating costs. And that's why we have healthcare costs at 20% of GDP. So if we simply eliminate third-party payers from the system, then we can allow the free market to establish prices. Prices would plummet. And for the cost of an insurance premium and copays, most people that would be all they would have to pay for all the health care that they would need, and even less. So it makes no sense to pay thousands of dollars a year in health insurance and then all the copays and deductibles, and then finally get some benefit from a health insurance plan. So how do you get the third-party payer out of the healthcare market? You eliminate government involvement in healthcare. You eliminate eventually, if we just move Medicaid to the states from the federal government, then we get the federal government out of paying for healthcare. States would each have their own individual choice to make. We the people in each state could clamor for free market health care, or we could permit liberals, particularly in liberal states, to continue to have a third-party payer system. So they could do that at their as much as they want to, and then free market-oriented states could have free market health care, and but that still leaves the insurance companies. So insurance companies, if you eliminate them as a third-party payer, we could do that by just legislating health insurance companies out of health insurance markets. Just make health insurance policies illegal. Now that sounds like a dangerous thing, and again, health insurance does not equal health care. So if you can understand that the existence of health insurance policies and the way that our market is structured right now, it's not a free market. It leads to escalating costs. If we could just realize that and eliminate insurance companies as third-party payers, we could fix the system. Alternatively, if you don't want to outlaw health insurance and you want to get insurance companies out as the third-party payer, then you simply would legislate that insurance companies can reimburse expenses, but they cannot have any direct contact, negotiating authority, or anything that puts them in direct between the patient and the healthcare providers. In that case, insurance companies would quickly go out of business because the free market opportunity for health sharing ministries would provide better sharing of those costs than the established system does. So either way, if we pursue free market healthcare, then insurance companies don't fit in that scenario. Health sharing ministries, or any group that wants to have a health sharing option for their members, that's a very legitimate way to share costs. All insurance does is just share the cost, share the risk. And if we're sharing risks, we're sharing costs on inflated prices 4 times, 5% of GDP to 20% of GDP. We can have an argument about what percentage of GDP would it be with free market healthcare. Back in 1960, it was around 5%. Now it's getting close to 20%. Could it be less than 5%? I don't know, but we need to get there. We need to, right now the single biggest question mark that people have in surviving economically, financially, without blowing their budgets or going bankrupt or anything like that, the single biggest concern is healthcare for most people. And it's because costs have been permitted to escalate, and it's a result of a third-party payer system. It's a result of tinkering by bureaucrats in a top-down approach, trying to control the market. We can just slice the Gordian knot by eliminating a third-party payer and permitting free market health care to flourish. We wouldn't have to legislate, any kind of price controls they're talking about for pharmaceutical companies. I mean, pharmaceutical companies charge different customers different prices. That shouldn't be. And if we wanted to still have insurance companies, then health insurance should be portable. It should follow the person. Companies should not be permitted to pay for health insurance coverage directly. They shouldn't be allowed to have a health, Amazon shouldn't have its own health care plan. Companies maybe would be permitted to pay for any plan that the employee has with a tax-deductible payment if the employee just takes their portable plan and says, pay this bill as part of my compensation and deduct it from my gross pay. That could work. But in one of my other proposals for a flat tax without deductions or exemptions, then that would not have any tax benefit. There would be no reason to complicate things by having the employer in the middle of paying for health care. That's another thing that the health insurance system has been very discriminatory against small business and has created barriers of entry and moats around large companies that's made it, frankly difficult for small business to compete. And so there are so many problems with the current health insurance, the structure of our health insurance industry, and all of the lobbying that goes on and the flow of money. It's all one big ugly, Gordian knot. We can just slice. So don't fear what the Democrats are selling. It's just fear-mongering. If the Supreme Court strikes down Obamacare, which they should, then legislators could just go back to the drawing board. It would be wonderful if they got along and attacked one problem at a time to try to fix, problems that we have, but they all too often try to package legislation that gives Democrats a lot of sweeteners in order to do something that we all need, like national defense for our nation. So a line item veto would be a great solution to that. So, health insurance does not equal health care. And if we eliminated, if government was not involved in health care and insurance companies didn't exist, then what would happen? What would happen to innovation, medical breakthroughs? What would happen to the price of pharmaceuticals? The inventors of insulin, a couple of Canadian doctors, they chose to give away their invention. And now, recently, I saw where a person on insulin has to pay like $500 a month for insulin. So it's all part of a massive price discrimination scheme that fleeces those that have some money and gives it to those that don't, because people that can't afford it wind up not paying anything for a lot of drugs. And people that have great health insurance coverage maybe pay little, and then those that are in the middle, get squeezed awfully bad. It's like that with so many things. So all those beautiful people the Democrats put forth today are not in danger of losing health care if Obamacare is repealed by the legislature or if it's struck down by the Supreme Court. They're just fear-mongering, and we need to just rest assured that some free market health care would go a long way to solving the healthcare problems that we have, the high cost of healthcare. Obviously, if you look at all the production of goods and services in this nation, healthcare costs do not represent 20% of value that's being created. You just can't ascribe that high number to it. So we can fix the problem. Vote out the Democrats. If there's a D after their name, just vote them all out. And then Republicans are also part of the problem, but we can work on fixing. If we get together and organize ourselves, we can transform the Republican Party so that the spineless Republicans that can't do what ought to be done, while Democrats are trying to destroy our country. They can't, they couldn't repeal Obamacare when they had the chance. They didn't do it. Well, that's, Democrats foisted Obamacare on us knowing that they would lose Congress, and they did. In 2010, there was a massive sweep against Democrats, but they got the job done. They're in the fight to the death. They could take the short-term loss. And now where are we now? Now they're trying to take additional steps to institutionalize single-payer health care systems. And they're trying to undermine our election integrity. And they're trying to, that's why I call the Democrat Party the party of division, destruction, and death. So we don't want a single party. If the Democrat Party succeeds in destroying themselves before they destroy our country, we don't want to have a single Republican Party running the show. We need to transform the Republican Party and invite libertarians to form the libertarian wing of the Republican Party, and the Constitution Party form the Constitution wing. I'm advocating for freedom cells to rise up and to organize and to function as the Freedom Caucus of the Republican Party. So the Republicans are complicit in the problems that we face. I'm not saying that they're innocent, but the Democrats right now they're locked in mortal combat. They're trying to destroy our country as we know it. They want to transform our country into a socialist, Marxist nation. So let's resist all their efforts and restore our lost liberties and come together and move as one and speak as one. And together we can restore federalism and restore national sovereignty, restore individual liberty, restore limited government, and unleash free market capitalism. Our country is worth saving, folks, and I look forward to hearing from you, and may God bless you and all that you do, and may God bless America.